Hello guys, Assalamu alaikum and welcome to Revise Pathology. Today we are going to discuss on the topic that is morphology of irreversible cell injury. So, the morphology of irreversible cell injury, that means irreversible. We have discussed in the last video that what is irreversible cell injury. That means where the injury cannot be reversed and it leads to cell death. So, the morphology is okay. So, once we talk about the morphology of the irreversible cell injury, it occurs by three processes. First one is autolysis. Second, necrosis. And third, apoptosis. What are those? Autolysis, necrosis, and apoptosis. So first, we will discuss about autolysis. All right. So guys, first process is autolysis. So what is autolysis? Autolysis is nothing but disintegration of the cell by its own hydrolytic enzymes. Okay, which is liberated from the lysosomes. Fine. So here we go again. So what is autolysis? Disintegration of the cells by hydrolytic enzymes liberated by lysosomes. Fine. And microscopically, what we will find? We will find their lost cellular details and the remains of the cell as debris. Okay. Repeating once again, what is autolysis? It is disintegration of the cell by hydrolytic enzymes liberated from lysosomes. And microscopically, what we will find is lost cellular details and the remains of cell as debris. Now we will go towards the second process, and that is necrosis. So guys, coming to the next process, and that is necrosis. So what is necrosis? Necrosis is nothing but it's the localized area of the death of the tissue, okay, due to the hydrolytic enzymes that is liberated from the dead cells, or you can say it as localized area of the death of the tissue followed by the degradation of the tissue by the hydrolytic enzymes that is liberated from the dead cells. All right, let's repeat it again. So what is necrosis? Localized area of the death of the tissue followed by the degradation of the tissue by the hydrolytic enzymes that is liberated from the dead cells. So basically, three processes occurs in it. What is that? First, death of the tissue, then degradation of the tissue by and the last step that is happening is the release of hydrolytic enzymes from the dead cells. All right. So that is, and this is all called as necrosis. Now let's see what are the types of necrosis. So the types of the necrosis are as follows. First one comes your coagulative necrosis. Second one is liquefaction necrosis. Third, gaseous necrosis. Fourth, fat necrosis. And fifth is fibrinoid necrosis. All right. So what are those? First one is the coagulative necrosis, liquefaction necrosis, gaseous necrosis, fat necrosis, and fibrinoid necrosis. Okay. So these are all the types of necrosis. Now, where we are going in detail of the different types of the necrosis, starting with coagulative necrosis. Hi guys. So we are here today. We are going to discuss on coagulative necrosis as we have done just previously. What coagulative necrosis? What is necrosis and what are its types? So the first type comes is coagulative necrosis. All right. So what is coagulative necrosis? Coagulative necrosis is one of the most common types of the necrosis. All right, guys. It's one of the most common type of necrosis. Next, where does it affect? It affects the heart. It affects the spleen. Okay, and it can also affect the kidneys. Fine. And what are the causes of coagulative necrosis? Simple: irreversible focal injury or irreversible cell injury, and due to sudden cessation of the blood supply. Okay, let's see it here. So, what is coagulative necrosis? It is one of the most commonest or common type of necrosis. Point number one. Number two, the organs that are commonly affected are kidney, heart, and spleen. Fine. Next, what are the etiology? And the etiology is or are irreversible focal or cell injury. Next is sudden cessation of the blood. So these This is coagulative necrosis. Now let us see what are it is morphological features and microscopic features. So guys, coming to the morphological changes or morphology, first of all we will see how will be the gross, what will be the changes, what will be the gross changes, what will be the appearance. Okay, first of all you will find the organ to be pale, you will find them slightly swollen due to an infarct. Okay, and you will find them firm. Now in an organ where the area is affected, how it will be? It will be yellowish, soft, and shrunken. All right, guys. So, what will be the gross appearance? Pale. So, overall gross appearance is pale, swollen, light, and firm. Okay, and the affected area where the organ is infected, okay, it will be yellowish, soft, and shrunken. Now, coming to the microscopy. In microscopy, you will find there conversion of normal cells into tombstones, and that is one of the biggest hallmarkers of coagulative necrosis. What is being there? That is conversion of normal cells into tombstones. Okay, and then you will find there lost cytoplasmic details, lost nuclear details, necrosed cells are being swollen, and nuclear changes are also being seen in them. So what are the microscopy? The microscopy are conversion of normal cells into tombstones, which is the hallmark. Next, lost cytoplasmic details, lost nuclear details, necrosed cells are being swollen, and nuclear changes are being found in them. Now, this is your coagulative necrosis. Let's go now to liquefactive necrosis. So, guys, proceeding to the next type of necrosis, that is liquefactive or liquefaction necrosis. Okay, it is also called as qualitative necrosis. Fine. What is it also called as? It's also called as colli collicative necrosis. Okay. And what happens in it? The hydrolytic enzymes that are liberated from the dead cells plays the vitalist role or the important role in creating semi-fluid material. All right. So the hydrolytic enzymes plays a dominant role in causing a semi-fluid like material. So what is the etiology? It is nothing but the ischemic injury. Come into the morphology, and the morphology is first of all the gross. There will be a soft, the material will be soft, okay, or the affected organ will be very soft. There will be a liquefactive center and necrotic debris. Microscopy, what you will see there in the microscopy is necrotic cell debris, macrophages, and phagocytosis will be seen in them. So repeating the morphology once again, the gross, what will be there in the gross? Gross will be soft with liquefactive center and necrotic debris. And in microscopy, what you will find? Necrotic cell debris, macrophages, and phagocytosis. Okay, let's go to next type of the necrosis, and that is gaseous necrosis. So, guys, coming next to gaseous necrosis, first of all, gaseous necrosis is the center of foci in TB infections, in tuberculosis. What is it? It is found as a center of foci in TB infections. Next, and it has the features of both coagulative and liquefactive necrosis. And it has the features of both coagulative and liquefactive necrosis. So, morphology. In gross, what you will find is there dry cheese-like appearance, soft, granular, and it is yellowish. But what you will find? Dry cheese-like appearance, soft, granular, and yellowish. Okay. Next, in microscopy. Okay, this is the morphology. Coming to the microscopy. In microscopy, you will find necrose center and granulomatous inflammation reaction. These are the two microscopic features. Okay, in necrose center you will find structureless eosinophilic material and disintegrated nuclei. Whereas in granulomatous inflammation, you will find epithelioid cells and giant cells of Langhans. So what you will find here is structureless eosinophilic material, disintegrated nuclei, epithelioid cells, and giant cells of Langhans. And this will be divided. The microscopy will be divided into two, that is necrosed center and granulomatous reaction. Fine. Now we will go towards the next type of necrosis, and that is fat necrosis. So guys, coming to the next type of the necrosis, and that's called as fat necrosis. What is fat necrosis? From the word itself, it is the necrosis takes place and in those positions of the body or at that place of the body where anatomically there is rich sources of fat. Okay, so what is it? It is nothing but it's a type of necrosis that occurs in fat rich anatomically rich locations. For example is pedunculous breast. And let's come to the morphology. And in morphology, we will see what is the gross and microscopy. So the gross is simple. It is having a chalky white appearance, yellowish white firm and deposits. Okay, sorry, yellowish white firm deposits. Fine. And microscopy, you will find like cloudy appearance and inflammatory reaction. So what is the morphology? Repeating it once again. First in the gross, you will find chalky white appearance, yellowish white firm deposits, and in microscopy we will find it as cloud appearance and inflammatory reactions. Now let's go to the last step of the necrosis, and that is fibrinoid necrosis. So guys, coming to the last necrosis, that's called as fibrinoid necrosis. So what is it's a very simple and very small. Okay, so basically fibrinoid necrosis, what is it? Is nothing but it is characterized by the deposition of the fibrin material. Okay, here it is characterized by the deposition of fibrin material or fibrin-like material. Fine. And if you will find its example, you can see it in many hypersensitivity reactions. For example, in immune complex or in author's reaction, you will find fibrinoid necrosis. Okay. Next, if you will go in the microscopy, what we will find there? We will find there hyaline-like deposition on the vessel wall. Okay. What we will find? What we will find there is hyaline-like deposition on the vessel wall. In the necrotic center, fine, in the foci of the necrotic center, we will find their nuclear debris. Okay. Next, we can also find their local hemorrhage. Okay, due to some injury of the vessel wall. Fine. So this is all your fibrinoid necrosis, and that's all with the necrosis. And now there's only one process left, and that is apoptosis. So let's go towards apoptosis as well. So guys, the next topic is apoptosis, which is one of the processes for or one of the processes in the morphology of irreversible cell injury. So let's see what is apoptosis. Apoptosis is nothing but it is a coordinated and programmed cell death. What is it? Programmed and coordinated cell death. Okay, or coordinated and programmed cell death. Fine. Next, let us see what are the causative agents or some of the examples. For example, in physiological processes, if we go, endometrial shedding is one of the best physiological examples for apoptosis. Normal cell destruction. And if we go, there is involution of thymus in early age. Okay. So what in physiological process, what are the example? That is endometrial shedding, normal cell destruction, and involution of thymus. Whereas in the pathological process, you can find cell death due to viral infections. You can find in heart, for example, in heart diseases, you will find destruction of heart cells, that is due to acute MI, okay, myocardial infarction. And we can find even pathological atrophy of organ. Fine. So cell death via viral infection, pathological pathologic atrophy of organ, and heart diseases, example MI. Okay, so these are the examples, and the causative agents and or the examples have been divided into two, that is physiological process and pathological process. So this is apoptosis. Now let's come towards it is morphology. So guys, we are proceeding towards the morphology of apoptosis. So in the morphology of apoptosis, we will see no inflammatory changes will occur. Okay, death of single cells will be there. Cell shrinkage is available. Apoptotic bodies will be present, and you will see phagocytosis of apoptotic bodies. Okay, so repeating it once again, what is the morphology? We will find there no inflammatory changes, death of single cells, cell shrinkage, and apoptotic bodies, and phagocytosis of apoptotic bodies. Now we will see what are the molecular changes of apoptosis. So guys, coming to the molecular changes of apoptosis, what we will find is there, first of all, it is being divided into three processes. First process is initiators of apoptosis, that initiates the process. Second one is the process of the programmed cell death, and last one is phagocytosis. Okay, so what are those? First one is the initiators of apoptosis. Next, the process of programmed cell death and phagocytosis. All right. So the initiators of apoptosis come into the first process, that is initiators of apoptosis. The initiators of apoptosis can be in any of the membranes at any cellular levels. Okay, it can be transmembranous, it can be at extracellular level, or it can be in intracellular level. All right. Now let us see what happens and what are the things or what are the processes or what are the steps that occurs in programmed cell death in this step. Okay, so the first one that occurs is activation of caspases. Okay, what is caspases? These are the proteins that activates the programmed cell death. All right, so what happens, what is the first step that occurs is activation of caspases. The second thing that occurs is activation of death receptors. Fine. Third step that happens is activation of growth controlling genes, and last one that occurs is cell death. All right, so what happens in this step in the process of programmed cell death? Repeating it once again, first one is activation of caspases, second activation of death receptor, third activation of growth controlling gene, and last is cell death. And then in phagocytosis, what happens? The last step that occurs is phagocytosis, that is no inflammatory cells is being there and no membrane change occurs at all. What is? No inflammatory cells and no membrane changes occur. So this is the molecular changes that occurs in apoptosis. That's all guys. This was the morphology of irreversible cell injury. I have explained all the three processes, that is your necrosis, your apoptosis, as well as autolysis. So all the three processes has been explained. All the three processes of the morphology of irreversible cell injury has been explained. Next, I even understand that I am not uploading my videos very much, like on a regular basis. I'm extremely sorry for that thing. It was just because of the month of Ramadan and there was Eid, so that's why. And just watch my videos, share them, subscribe to my YouTube channel Revise Pathology, like my videos and stay healthy. Till then, Allah Hafiz. Assalamu alaikum.